couple more people.
She wants to start on time, and then she's gonna let people as they come in.
Good evening, everyone. It is 6:11. My name is Marilyn Peña. I am the committee chairperson for Health, Human, and LGBTQIA Blood Services. I'm going to start with introductions, starting to my left.
Hi, everybody. I'm Argelia Ortiz. I'm a board member. You can just call me Argie, like everybody knows me as Argie.
Hi, good afternoon, everyone. Gina Williams, Bronx Borough Director, DSS IGA.
Hi, good afternoon. Jamar Hooks, Deputy Commissioner for Intergovernmental and Legislative Affairs at the Department of Social Services.
Good evening, Jose Quintana, representing the New York City Department of Health, Tremont Health Action Center.
Good evening, good afternoon, everyone. Madam Chair, ladies and gentlemen, Anthony Jordan, District Manager to the Board. If you're speaking for the first time, please make sure to say your first and last name for our system to pick you up. Our meeting is being broadcast live on our social media platform and on our YouTube page. The owl in front of you right there is really
Beautiful. So we're just gonna go quickly to old businesses. We do have a presentation, but the old business is the health fair check-in. This is August 1st, our first Healthy Families event. Really quick, we are excited. We've been getting a lot of vendors who have been confirming to participate. So I am at the very last stage of finalizing a detailed letter for participants. It's pretty much showing the setup of the fair, the set down, the break, just all the stuff, the assigned seatings for the vendors. I think that's important. We want to make sure that we are providing a blueprint to our participating vendors. We're eventually going to have a meeting with them, most likely on the first week of July, so that everybody's on the same page. We're actually excited. We will have several vendors who are gonna be assisting our constituents in the area with high blood pressure, HIV testing, STDs, cancer screenings, you name it, all that good stuff, but also activities as well. We are delighted to also have FDNY to provide a workshop for fire prevention. That is important because the Bronx is, again, burning, and so we want to educate our constituents and our families and the communities to better prepare. That is all. Do you have any?
right. Thank you, Chair. So we are also planning to have the New York City Department of Health and Mental Hygiene, the New York City Department of the Aging, we're waiting to hear back from the New York City Department of Social Services that's going to lock in and help do some support. We're working with our partners also within other city agencies to provide informational resources and the Department of Youth and Community Development on winter youth employment programs and weekend and out of school time programming. So this is an amazing opportunity for us to partner with a great organization in the district, Hype Family, also from the Administration for Children's Services. So we're excited about what this is going to definitely do to help improve the connection between our constituents and our city agencies. So
Yes.
thank you.
Yeah, and really quick, this is something that's so important to our hearts. There are a lot of health disparities going on, and we want to be able to best support our constituents. There's a lot of changes going on with benefits in general, and that is going to lead me to our next step for our new business, which is our, and our SNAP benefits. But before we start, intro.
Hi, I'm Jacqueline Vissels, Vice Chair for Health, Human, and Obesity Committee.
Yes, and then we're gonna proceed with our SNAP benefits presentation. We do appreciate you guys for coming. I know that we had like a side conversation before. This is something that's very important, and we want to be able to best educate our community, but also try to figure out how we can, not have the community frustrated with the changes. So you're more than welcome to proceed.
Okay. Well, good evening. Again, I'm Jamar Hooks. I'm the Deputy Commissioner for Intergovernmental and Legislative Affairs at DSS. And DSS includes DSS itself, which provides administrative support to HRA, and DHS, some administrative support includes my unit, Intergovernmental Affairs, personnel, budget, all of those things are within DSS. And then we provide support to HRA, which connects over 3 million New Yorkers to a variety of benefits and services, including SNAP, which we're going to talk about today. We also oversee the Department of Homeless Services, which works to prevent homelessness before it occurs, reduce street homelessness, and assist New Yorkers in transitioning from shelter into permanent housing. I'm going to come back at a later date. I have that agreement with Anthony to talk through DHS services, but today I'm going to focus on HRA and what work requirements are coming down the pike and what that means for your constituency. So in early 2025, the federal government, the Congress, the president signed a federal budget reconciliation mega bill, HR 1, also known as the Big Beautiful Bill, which radically reshaped the safety net by drastically expanding work requirements for the Supplemental Nutrition Assistance Program, also known as SNAP and formerly known as food stamps, and they introduced Medicaid work requirements for the first time in history. So for SNAP, it expanded what's called the able-bodied adult without dependents work mandate to target older populations and previously protected groups. So there's always been these work requirements. They've always exist, but we had a waiver as a city and we weren't required to implement the ABOD rules until HR 1 passed. Now that HR 1 has passed, it also includes older adults over the age of 64 and other groups that were previously protected. This also in HR 1 legally tied health insurance coverage directly to employment or community engagement for the Affordable Care Act expansion population. So all of those who are receiving Obamacare, they are now or will be soon subject to work requirements. So in Medicaid, the working age adults are ages 19 to 64. So anyone between the ages of 19 and 64 are required to work at least 80 hours per month. It has to be verified of qualifying activities. Those activities include paid employment, so your everyday job, community service and volunteering, job training programs, or being enrolled at least half-time in higher education. Alternatively, they can show a monthly earning income of at least $580. We have the ability to exempt folks if they're pregnant, if they are disabled, and if they are caretakers for children under the age of 14, they could be exempted from Medicaid work requirements. And these work requirements for Medicaid are, as I said, coming down the pike. The states were required to work on a plan to fully launch the tracking systems by January 1st, 2027. So the state has, in New York State, Gina, you could turn to the next slide, please. Next one. In New York State, the state oversees the Medicaid population for the vast majority of Medicaid recipients. But in New York City, we manage the disabled, aged, and blind population. So anyone who's disabled, aged, and blind and is in receipt of Medicaid, they come to HRA. If you are not disabled, aged, or blind, you go to the state to get your Medicaid. All of those folks that are going to the state for their Medicaid, they're required to meet the Medicaid work requirements that are going to come down the pike in 2027. The folks who are on our Medicaid program, the disabled, aged, and blind, they're all going to be exempted. So we feel good about that, but we have 3 million clients, right? And so only a small amount of them are Medicaid eligible under HRA. The rest of them are receiving Medicaid from the state. So even though our population is protected, there are millions of other folks that are going to be impacted by the Medicaid work requirements. We still don't have details on what that looks like, but we understand the general parameters of what has been set by the federal government. The state is going to promulgate rules and regulations and let the city know what they plan to do because, as I said, it's their population. So they will tell us how to move forward, but just know that Medicaid work requirements are coming. People aren't talking about them because they aren't to be implemented into 2027. So even though folks are not talking about them, it's very much on the administration's mind, very much on our clients' minds. And the overall thing about these work requirements is that they are very punitive. They're not meant to actually be about work. They're about getting people off of benefits, right? And so we are doing everything that we can to exempt folks. And that means if you are, if you have a qualifying disability, if you are unable to work because of a behavioral health challenge or because of a physical disability, you could be exempted from these work requirements. And so we're doing everything in our power to exempt as many people as possible under the rules and regulations. And I'll talk a little bit more about SNAP, but we have exempted about, I think 60,000 people and 80,000 altogether have complied. There was a total of 120,000 people that were impacted by ABOT rules. There's 1.7 million New Yorkers that are receiving SNAP in New York City. 120,000 of them are subject to ABOT rules. The rest of them were already exempted. We worked with that population of 120,000 and we exempted the vast majority of them. So right now there are only 40,000 left that are not in compliance with ABOT rules. So, I mean, even though there's 1.7 million in totality, I think that's 2.5% of the population are not in compliance with ABOT. So we expect that out of the 1.7 million, 40,000 are going to lose their benefits at some point in this month. Their SNAP benefits at some point in this month. I think another thing for you to know, next slide please, Gina, is we also have cash assistance. And basically cash assistance provides ongoing assistance or rental assistance for clients and helps them meet their basic needs. It's a very small sum of money, but there has been longstanding work requirements for cash assistance. I think everybody knows this as a part of Bill Clinton's 1996 welfare reform. Clients were required to do work requirements to receive cash assistance. So that nothing has changed with respect to cash assistance. But there was, next slide, please, and next slide after that, the career services. There was a pause on mandatory engagement activities. They were suspended during the pandemic in October 2023 for cash assistance. But starting in May 2025, we resumed cash assistance work requirement. The good news is if you are on cash assistance and SNAP, you don't have to meet both work requirements. You have to meet one or the other. So if you're meeting cash assistance work requirements, you are already in compliance with SNAP work requirements. And then we have career services. Can you go back one, please, Gina? Thank you. Career services is basically our programs that focuses on improve the individual assessment for clients receiving cash assistance. Our services seek to address each client's actual strengths with a focus on maximizing education, training, and employment-related services for job opportunities that create basis for career pathways. So clients who need to meet work requirements, they can come to us for that support. We have our career services program, which can connect them to vocational educational opportunities, high school equivalency courses, adult literacy classes, and English as a second language. So if your constituents are saying, how do I connect to the type of services and programs to get in compliance, the agency offers those type of services. So they just need to come to us and we are able to connect them to the supports that they need to come into compliance. There's also 2- and 4-year colleges, which allows you to be in compliance. So attending college, I think on a full-time basis, 2 and 4 years can fulfill work requirements for up to a year. Clients can also participate in full-time basic education, English as a second language, and high school equivalency beyond the current 12-month limit. And then there is car fare and child care assistance available for anyone who needs it to help them fulfill their work requirements for cash assistance. Next slide, please. So I think the main reason I'm here is to talk through SNAP ABOT requirements. So the SNAP program, as you know, provides eligible individuals and families with help to pay for food. Eligibility depends on a variety of factors, including household size, expenses, and benefits, and income. There's single issuance benefits, which can be expedited within 7 days of the application. SNAP households usually include spouses, children living with and under control of an adult and biological adopted parent of children under the age of 22, and then also elderly or seniors who have a disability, and their spouses may qualify for separate household status, even if they purchase and prepare meals in common with other household members. That allows them to maximize their benefit. And speaking of ABOD, as of November, the ABOD stands for Able-Bodied Adults Without Dependents. As of November 1st, 2025, HRA was required to implement the SNAP eligibility requirements for ABODs. Beginning March 1st, 2026, ABOD identified individuals are required to comply with work requirements. So under federal law, SNAP clients who are considered able-bodied adults without dependents need to meet certain work requirements. Generally, adults who are aged 18 to 64, who do not live with the child under the age of 14 in a household, who are not pregnant or caring for a person who cannot care for themselves, or who do not have a physical or mental or physical barrier to employment. Everyone else who does not meet that criteria are required to participate in work requirements. We have been working to exempt as many people as possible. So if you are a person that lives with the child under the age of 14, if you're a person who is pregnant or who cannot, or caring for a person who cannot care for themselves, or if you have a mental or physical barrier to employment, you can go to what's called WeCare. WeCare is an assessment program within HRA. They assess you based on your medical history. There's doctors at WeCare, but they're basically, if your doctor says that you cannot fulfill work requirements, then we're exempting you. If you're a pregnant person, we're exempting you. If you're caring for someone else that cannot care for themselves, we're exempting you. If you have a child under the age of 14, we're exempting you. So in total, there were 120,000 individuals that were potentially impacted by ABOD rules who had to come into compliance. We exempted or helped 80,000 of them come into compliance. So at the end of this, at the end of June, we're going to assess where we are in terms of folks who are not meeting compliance. But right now, there are 40,000 folks that are potentially going to lose their benefits at the end of this month. And I'm going to be able to provide you with additional detail on how it's impact this district specifically at the end of this month. So I'm going to provide that information to Anthony as soon as I have it. So to keep, next slide, please. Thank you, Gina. To keep getting SNAP benefits for more than 3 months in a 3-year period, each ABOD must follow the following ABOD work rules. You have to spend at least 80 hours every month, 20 hours per week, doing one or more of the following. You have to work, getting a paycheck, a salary, and that includes in-kind work. So in-kind work is like if you are a super of a building and you're doing work, but you're not receiving a paycheck, but you live, you're able to live in a building without paying rent. That's kind of in-kind work that they're talking about. So you could work traditionally, go to work every day, get a paycheck, or you could do in-kind work or a combination of the two. You could also participate in qualifying work training programs approved by HRA. So if those people that are looking for work, they should connect to Career Services, and we'll count those efforts of participating in work and training activities as a part of their meeting their work requirements. So if you are participating or training for to work, then that counts as well. Also, if you're participating in employment and training programs for veterans operating by the Department of Labor or the Department of Veterans Affairs, or if you're participating in the Workforce Innovation or Opportunity Act or Trade Act, which may include job searching, job readiness, occupational skill training, and education activities. Or you could participate in a combination of work or qualifying work programs. So you could do a little bit of this, a little bit of that, but you have to be doing it for 80 hours every month. That's 20 hours per week for each month. And anyone who is not doing that is going to be out of compliance. You can only be out of compliance for 3 consecutive months or 3 months, right? So if you get an initial strike, and then you get a letter from HRA saying, hey, you're out of compliance with with work requirements. You have to come into compliance. Here's how you come into compliance. Here's the steps that you should take. And all of that is included in the what we call the strike notice. Clients will have to do all of the things I previously mentioned to come into compliance. They have to go to WeCare, get an assessment, and either be exempted or start participating in any of these work requirements that are on the screen right now. So that is SNAP in a nutshell, but just some additional information that's not on this screen, but I did want to share with you. Late last year, we identified around 342,000 New Yorkers who were at risk of losing their benefits because of the new federal requirements. The city's strategy to protect those on SNAP and ensure that they retain their benefits have been twofold. First, we strive to exempt everyone who is eligible for an exemption, and as I said, we've exempted 80,000 folks. And then we're focused on outreach and engagement on people who are not eligible for exemption by connecting them to meaningful work, training, education, or volunteer opportunities. These efforts have helped more than 220,000 SNAP recipients potentially impacted by work requirements obtain exemption, and tens of thousands of other New Yorkers complied through engagement and employment, volunteer, and vocational activities. Today, 43,500 individuals, or 2.5% of the total number of SNAP recipients, 1.7 million, are not in compliance and at risk of losing their benefits. That represents 34% of the 126,471 SNAP recipients required to comply with the new federal work requirements. So since October 2025, DSS has worked to consistently communicate the changes to impact the SNAP recipients. We're doing this in the snail mail. We're doing this on social media. We're doing this in their Access HRA accounts. We are having conversations with elected officials. We're doing door knocking. The commissioner actually participates in door knocking. So we are triangulating based on the highest need communities, right? So we know where folks are most likely to not be in compliance are at. And so the door knocking efforts have been in those communities. And that's the Mandani likes to do door knocking. So this is what he has tasked us with doing, and this is what we've been doing. So we are hoping to see a noticeable reduction in a number during this critical stretch. We will know more about who's losing benefits closer to the end of the month, but as it stands right now, only 2.5% of the total number of SNAP recipients are out of compliance. So only 2.5% out of the 1.7 million. That is a small number, right? It's 46 or 43,000, but for the folks that it's impacting, it's very real, right? They will have to rely on soup kitchens and food banks to meet their nutrition needs, which are also managed by HRA. But we're trying as hard as we can to exempt even more of those folks. So the way that if you are at the end of this month, people will know that they are out of compliance. They have 3 strikes. And the way that you get back in compliance is that you come to HRA, you say, I'm working 80 hours, or I have the intention of working 80 hours, and here's how. And then we could, reestablish your case and start issuing benefits again. But just to be very, very clear, if I haven't been clear about this already, this is not something that HRA wants to do. It's not something that we enjoy doing. In fact, we feel horrible about it. But the federal government, via HR 1, has required us to do this very capricious thing that we are now seeing the outcome, which is 40,000 people are set to lose their benefits at the end of this month. So that is work requirements in a nutshell. I'm happy to take any questions that you all may have.
Thank you so much. I'm gonna open the floor. Any questions you guys have or concerns, please be brief, mention your name, and just keep in mind that, again, this is not something that SNAP we decided to just do it for fun. This is something that was forced to, based on the bill. So I'm opening the floor. Archie,
Just want you to rearrange the furniture, just want you to say. Go.
No, I'm giving you a little bit there. I was being a little blinded by the sun, you'll have to excuse me.
Oh, no
it's
worries.
okay.
There are actually a lot of questions.
Okay.
If a person, well, okay, that's looking at a far-fetched future, but, one of the students, that I mentor, she's at the community college, and she told me she received a letter already.
Mhm.
She is on the work study program, she's in a nursing program, right here at HOSIS. And, my understanding is that during the semester, she does work study.
Right.
During the summer, she will not be doing any kind of work at all. They did send her a letter telling her that that's gonna it's gonna affect. She won't be back in work study until September.
But it actually has I don't mean to cut you off, but it has nothing to do with work study, right? The compliance in terms of education is based on full-time enrollment in a 2-year or 4-year college. Whether they're doing work study or not, they could be exempted based on their status as a full-time enrolled student.
That's what I figured. So that means that her full-time student status, although
Even in
during
the
the summer
summertime.
she will go on vacant, but she's gonna be coming back in September to finish up.
Yeah.
And she's gonna be graduating from the nursing program.
So you're essentially
Okay.
certified for a year. If you're enrolled in college for the full year, you're certified for the year, whether you are enrolled in the summer or not.
Okay, maybe she didn't understand the letter,
Yeah, maybe.
because I understand they send everybody a letter about the requirements, and maybe that's why she's saying that they're gonna.
But also she needs to, maybe she's not, hasn't had the conversation with her. So she needs to go to HRA, let them know that this is where I am, this is what I'm doing, this is how I'm complying. So everyone's gonna get the letter, but you have to comply by saying, I'm enrolled in college full-time. I need to be exempted based on that.
She might have to show them her actual record from the college.
Correct,
So they could put that in her record,
correct.
and then she won't be cut. I see.
The person has to do something, like they have to take initiative. It's not gonna just be an automatic exemption. Even for the people who are, for someone who has a child who's under the age of 14, we'll know that because the child will be a part of their household. So we're able to exempt those folks. But we won't know, for example, if you're taking care of someone who is unable to take care of themselves. We won't know necessarily if you're pregnant. We won't know if you're enrolled full-time in college. So those are the things that you have to tell us so that we could exempt you.
I see. So let's say, again, what about, there are actually a lot of cases that could be individual. Another friend I have, he's on SSI. He just finished having heart surgery.
He's exempt.
Is it, okay, does he have to go to HRA to make sure that he's exempted?
He shouldn't
is
because
that
he's
already-
on Medicaid. He's on
He's on
SSI.
SSI.
And so
Yeah.
it's clear that he has a
That should be in the system
disability.
already.
Yeah,
Understood.
yeah.
Thank you
You're
for clearing that. Thank you.
No
I
problem.
also wanted to comment, because I think that's important too. The best practice would be for any person's case scenario, if they don't know if they're exempt, would be to go in person or to contact them.
To go in person.
Person is the best practice.
Yeah.
Okay, perfect.
Yeah.
Anyone else?
Madam Chair.
Yeah.
Thank you, Chair. Thank you, Commissioner, for you and your team, Ms. Williams, for coming out and explaining this issue and how important it is for the administration to ensure that our reach to dispel myths or is understood about this requirement that's been handed to us by the federal government. Talk to me about, or to us about, what are approved. We talk about what approved, what areas are approved. If I volunteer in my church, is that an approved work activity? Or if I volunteer in
Community service.
other type of community services on the level, what is approved, deemed by HRA, and how can someone certify the volunteer interactions other than internships and other work activities to ensure that we are meeting whatever those requirements are for the case?
Yeah, so we have MOUs with a number of community services providers. So you have to work specifically at those places, right? You can't just do, I mean, some churches are approved, and they're on a list, but you can't just do whatever you want. There has to be, there's a rubric that folks have to follow. And so we have a list of community service providers that we have MOUs with. Those are the entities that folks can volunteer with. You can't just volunteer at your church because it won't count towards. But if the church connects with HRA and say, we have enormous opportunities for folks to participate and meet these requirements, can we get these programs approved? That way, the person can have their volunteer efforts counted if it's an approved program.
So SNAP recipient should always make sure to check with whoever they are, quote unquote, performing the hours are.
Correct.
That's good. Thank you for that clarification, Commissioner.
Okay.
Talk to me about your unhoused population who may be recipients of SNAP benefits. And we understand that sometimes if I'm unhoused, I don't have the ability to be quote unquote presentable to participate in a work requirement for whatever the reasons are. I don't have access to shower, clean clothes, whatever, or maybe struggling with a mental illness. How is the administration working to ensure that those individuals have the ability to still have ability to qualify for a program they definitely need so they can be able to eat, but there's requirements based on them?
I mean, it's even more basic than that, right? Like, how do we get the notices to a street homeless person?
Sure.
Like, how do we get the information out to them? So that's something that we're working on, to be perfectly honest with you. And they, unfortunately, aren't a category that's exempted. So many of them are going to lose their benefits. And so we are figuring out what that means. I mean, we have HR, as I mentioned, manages soup kitchens. We manage the food pantries, but that's no supplement for SNAP benefits. And we recognize that. But the unfortunate real answer is that many of those folks are going to lose their benefits because A, they're not receiving the notices, and B, even if they're receiving them, they aren't necessarily going to be come into compliance because they have mental health challenges. I mean, they could be exempted based on those, right? But we need them to get the letters. We need them to know what's happening. We need them to come in and get exempted based on the number of criteria that you mentioned. So the unfortunate situation is that many of the street homeless folks are going to be left without food support other than what's available at the pantries and the soup kitchens. And of course, we don't want that, right? That's not something that this administration wants. But unfortunately, we are dealing with a federal government that is passing all these capricious laws that are falling saliently on the shoulders of poor people. So that's where we are. I'd like to give you a different answer, but the real answer is that many of them are going to lose their benefits.
Right. And then my final question, I know my brother wants to ask a question, Commissioner, is while we don't want our families or individuals to depend on food pantries, soup kitchens, the lay of the land that's going to become a reality for a lot of people, especially for those who meet those requirements and still need assistance because for our food pantries and soup kitchens as a additional supplement given the increased prices. But we can talk passionately about that forever. Is how is the administration working to ensure that they're either expanding the bandwidth or finding new avenues to have where there are range of food programs that provide hot meals or showing up our food pantries and kitchens who do so much great work as the administration knows, because you guys are supporting them to ensure that they can meet the demand where there are gaps. And from this system or the regular wear and tear of how the people need food pantries and soup kitchens.
So this administration has invested deeply in soup kitchens and feeding programs. We increased threefold increases in food assistance. So it was at 20 million. And the Adams administration is now over 60 million. The advocates are asking for 100 million specifically to address the gap caused by folks that are going to be left uncertain, food insecure by the ABART requirement. So advocates are calling for 100 million. The administration has included 60 million in their executive plan. So it definitely recognized that this is an issue, and they responded by tripling the food supports.
And I just want to build on what we talked about with our chairs, that this community board stands ready to assist the administration to continue to make sure we get the word out, to work with your borough director to ensure that we dispel myths and make sure we refer families who are meeting the need to be able to come to get immediate assistance before strike 2 or 3 comes up.
Yeah.
So that we make sure that families are as they become familiar with this center. And then we also are pledging to provide space for to increase SNAP participation for people who qualify with our HIV rep to ensure that we get as many families and or individuals who are needing SNAP and help them to also, like I said, to understand those requirements. Thank you, Madam Chair.
You're welcome. I have one comment, and just maybe a concern. How does your centers look like for the workload? Because I can only imagine the amount of individuals and families who are now have to delegate this now. They have to figure this out. What is that gonna look like for your centers and your caseworkers?
So it's only 100. I mean, I say this like delicately, but there was only 120,000 people that were impacted by this change. So we are equipped to deal with that. We manage an influx of folks on a daily basis. But the good news is that the majority of what needs to happen in terms of assessment is not happening in the centers. It's happening at what's called We Care.
Mm.
And so We Care is designed to specifically deal with this issue. The other point that I should make is that, we have our one number, which you can call HRA. There are very long lines to get service on the one number, but there's a dedicated line specifically for SNAP. I think it's like 718 SNAP Now.
Yeah.
It's the number. And so there's virtually no wait to get a response on SNAP Now. So we have the number. We have the dedicated services, and we have the assessment center that's specifically to address this issue. So I think that we are doing well. We've had to stand up an operation extremely quickly.
Yeah.
There was no rubric for this because we were exempted in the past, but we have successfully exempted 80,000 people. So. And we've made contact with thousands of others. So
Yeah.
I think we have capacity. Our centers, to be honest with you, sometimes they're full. But I think that we are able to meet the challenge based on our resources.
All right, I just wanted to ask, because just thinking about that.
That's a very good question.
Yeah, and again, I'm coming from social services myself. I managed several sites before I left, and I can only manage how those CBOs might be, experiencing with this big change. I can only imagine, and also the short staff of it.
Yeah.
But we want to be able to also best support you guys. We are a community, but we also want to provide the actual facts to our constituents.
Yes.
We want to ensure that they are fully aware, and if there are any discrepancies that they are experiencing, then maybe we can be able to just shoot you guys, email, and the district manager will be able to facilitate that, because we want to just provide that, increase the outreach, but also figure out how we can best help each other out.
Yeah.
And I know that as I mentioned earlier, I'm always on the website trying to inform our constituents any updates. And I know you guys have been on point with those updates on a day-to-day, and we do appreciate that. I just want to make sure that, if there's something that's like a glitch or any of that sort, that we can be able to just notify you guys as soon as possible.
Yeah, you contact me, contact Gina, we're happy to assist. And then just quickly, because I know you have a couple of questions, but Mr. Jordan, you mentioned having support in the office. I don't know if we have the capacity, because of all that we're doing, to get the word out at this very moment in terms of outreach for ABOD as an agency, but we have community partners that do that type of work. They come into different spaces, and they, work on enrollment issues, they work on ABOT issues. So we could connect you to a community-based organization that could come. But right now, I think we're a little stretched working on the ABOT issue itself. And so we don't have capacity to staff in anybody's office. So we could connect you to the CBOs that are doing that type of work.
I'd love to follow up with you about it, because my colleague in Community Board 12 mentioned that there's an HRA colleague, but we can circle back and
Okay.
this clarification.
Yeah.
That looks like.
And even if it can't be now, this is something that maybe we can try to figure out for September, because I can only imagine how that's gonna continue to look.
I'm hoping that what you're gonna hear in September is that there are 10,000 people that, are not in compliance, because we looked at the numbers again, and there were only 15,000 people that were not in compliance, that had 3 stripes. So this month there are 40,000, next month there are gonna be about 15,000. So the number is decreasing. So hopefully when I come back again in September, I can tell you that it's even less.
So even when, sorry to cut you off, but even when we have those, our constituents who are pending for recertification down the line, because how I'm looking at it is like, not everybody received that same recertification on the same month.
Right.
They have different months where they recertify, and they are getting those type of awareness, that letter, because I've seen it. So we're just hoping and pray that it's decreasing instead of increasing.
Yes.
Okay, got it. Jose?
Hi, thank you. Jose Quintana, Department of Health. I'm gonna backtrack a little bit. You mentioned, we were talking about volunteerism and organizations that folks can volunteer for. You said there are some approved organizations that DSS has an MOU with. And I was wondering, is it going to be up to the individual to provide that verification of volunteerism, or will those organizations which have the MOU with provide that?
There's a form
There's a form.
that they have to sign at the end of each month.
The
Certified.
individual will sign it with the volunteering organization, and then it'll get over to you.
Yes.
I work closely with the community. I know things like that questions like that may come up.
Yeah.
Especially for folks who are volunteering at churches and others. And that was the other part of the question was, I'm sorry, would you please repeat what you had mentioned about churches that may not be having an MOU with you now, but they have reached do they have to provide information regarding how the person is volunteering, or the volunteer services that they can?
You can't just volunteer at a random church. There has to be a church that's on the list.
That's on the list.
So if a church has offerings, they should come to HRA and get connected so that they are an approved volunteer location.
Thank you very much for clarifying that. I appreciate it.
And I have a question. So for adults and people on the spectrum, right? When they getting these letters, like how does it go about for them? Because I know a lot of them may not even understand. Like, are they gonna get not also letters but also phone calls?
No.
Any of assistance? Because I know many of them don't read, many of them don't. They get this information and they're not even familiar with what it is about. These sources. So
Yeah, I mean, I'm hoping what happens, and it's anecdotal, but I'm hoping what's happening is that they are receiving the letters. If they're not able to, or have low literacy, they can come into the center and get the support that they need, but there's no one that's calling them to follow up, right? So if you're not in compliance, you're gonna get the first letter. And if you're not in compliance again, you'll get another letter. So at some point, I'm hoping that they are going into the center and saying, hey, I don't understand this, please help me, please explain this to me and let me know how I can come into compliance. But there's no one that is calling after you get the notice, because the notice is in your Access HRA account, which is our online platform. And then it's also sent in a snail mail. So, but there's no cold calling that's happening.
Is there a way, because to piggyback to what Jackie is saying is very valid, we do have constituents who are on the spectrum. Is there a way where on the second notice you can put that in color, because there's nothing in color in your notification? It just says this is the second, you get what I'm saying?
Yeah.
Like, I just want to see how can we be able to provide that proper clarification for our constituents where they feel that they're not ignored.
Yeah.
Because of their disability or being on the spectrum.
Yeah, I don't believe there is a way to do that, and I think, you know, we're also cost constrained, so we're not printing in color
No, for
necessarily.
sure.
But I'm gonna take back your concerns to the policymakers at HRA, and then I'll get back to Anthony.
Yeah.
Well, I want to, and I'm going to jump in front of you, Audrey, just a little bit. The reason why we're saying that because disproportionately, our district is one of the highest population of numbers of people who are on the spectrum, and that may, and so that may be a large dip of people who are on the spectrum who don't meet the disability criteria because they're working, they want to be engaged, they want to be active, but they need help sometimes from an elderly parent or a parent who is doing her best to, or his best to be able to, you know, keep life together for themselves. It has come once in a while to make sure they may need some more. So I just wanted to, I know that this was a long time coming. How much more education or how much more training has happened on a center level in the job centers and other places for sensitivity, for understanding, for I know the laws are laws. We're not asking for more than anyone to break the law to ensure that folks on wherever they are, wherever they used to be back at. I'm going back a little bit far. Dating myself, Roberta Anderson was commissioner of DSS. Her thing is meet the client where they're at. Meet them where they're at. You'll get more of people to be compliant with the reality of what the system requires. How is it? And I know that this is part of that, bringing a message, outreaching, commissioner doing door knocking. How are we looking at other policies or policies pretty much formulated already about how to be able to, how this is going to be outplayed into the world? Does that question make sense? I kind of left gaps in it.
Yeah.
To see where you could filter it.
I think we still want to meet people where they are. We definitely want to meet people where they are, and exempt as many people as possible, right? So if a person is coming to you and saying, I have a parent, or I am a person that is on the spectrum, they could potentially be exempted based on that status as a person on the spectrum. But it's difficult to know because they have to go through the exemption process. But I think overall, we're still trying to meet people where they are, essentially.
Right, and I appreciate that because if you look at again, it's proven in many publications that that's the reality of certain areas in New York City. It is it's more in my district, and we're working to strengthen our schools to ensure to meet those needs for young people, but also knowing that this is something that was classified as how we dealt with it formerly is differently how we're dealing with it now. So I would love to learn to have one of my many passionate conversations with you, advocacy conversations about that, and I appreciate that. So I'll stop here. Thank you, Chair.
Okay, so thank you. To just slightly reiterate what you said, do employment hours count towards the 20 hours?
Yes.
Okay, so how do the clients actually know? Is there a way that they can know what are the approved work size? Do they get a list of the organizations or centers or something?
It's if you work at Walmart, you work at Target, you work for the city. Those are all. If you're getting a paycheck, that's the approval, right? So you have to. We already know if you're getting a paycheck because you have to recertify periodically. So if you're getting a paycheck, you are working, or if you're doing in-kind work as well. So that, as I mentioned, if you're a super of a building and you are working but not getting a paycheck, but you are getting your rent paid for, or your rent is included as part of your compensation. So all of those things are viable opportunities to present to the agency and say, hey, I'm in compliance because I'm working 20 hours a week at Walmart. I'm working 20 hours a week at Walgreens. I'm working 20 hours a week at Target. And I have a paycheck, and I'm proving that to you once I recertify. And we know if you're working, right? And so you can't really tell. Some people in the past would tell the agency, I'm not working, so that they can get more of a benefit. But there's actually a system, it's called Talks, T-A-L-X. And Talks lets us know that the person is receiving income. So we already know that the clients are receiving income.
I see.
But they are required to report periodically by providing their page stubs and
Okay,
that sort of
where
thing.
they fill out for
Yeah.
that. So if a person is borderline, let's say they work 19 hours a week,
It's not enough.
that they still have to find a place where they can
Yeah.
meet that 1 hour.
The 1 hour,
We
they could,
had
they
that
could,
conversation earlier because we wanna be able to support all scenarios,
Mhm.
right? And so it's unfortunate, right? Because there's people who are working, they think that 19 hours is a lot, but it's not a lot. It's not, that's not the requirements. I have, and I know we're like almost at the end. I do have a comment question. Is there a way where we have, because community boards throughout all boroughs, but speaking for here, we do have a lot of people who come to the community boards. And they want to be informed and they help volunteer. We do have a food distribution on Saturdays.
Mhm.
I want to know, or if you're able to take that back,
yes.
how is that, can that be a requirement? Can that be part of, something where our constituents who are just like barely making that 20 hours and they come here to help provide food distribution or, yeah, and community engagement, all that stuff. Like,
Yeah.
how would that look like? Is that something that would be acceptable, or if you're able to take that back and see how we can be able to work together, because this is gonna be intense, and we know that it's not your fault. You guys did not create this, but there's a lot of families right now who are frustrated. And as a single mother, I don't know how I can be able to make more hours when clearly my full-time job is to take care of my kid.
Right. So I will definitely take that back and see how a community board or any organization, because I'm not clear on this, how they become an approved volunteer site. That's in the weeds. I'm not involved in that
That's
level
fine.
of detail, but I will definitely bring it back. Gina, please remind me. And we will let you know how you become an approved site.
Thank you so much. I have nothing further to say. I do want to know whether or not, this is so informative, if you guys can actually bring other members to present it for the general board meeting, or because we want to be able to, not only is this live, I'm pretty sure there's a lot of constituents who are really concerned and is trying to figure out the solution. Again, when they receive these letters, they think that the world's ending.
Yeah.
And we want to be able to best support them. And we don't want to do it in a way where we're not, where we're anti, or we're just like trying to we don't want to do that. We want to be a safe space.
Yes.
But we also want to provide that proper education and clarification to the community to understand what are the steps.
Mhm.
And I think the best practice, like you said earlier, was for people to go in person to get that clarification, also inform the representatives that this is what's going on, et cetera. I'm just hoping if you guys are open to provide a group of someone from your team to also present or even provide information, or even a help sheet that can be able to provide for the community for our general board meeting, because this is gonna be our last one
Mhm.
before we resume again in September. And I think,
When is it?
That's the
the last Thursday of this month.
Oh, this month.
24th.
Mhm.
The last
That's gonna be on
Thursday,
the 24th.
the 24th, if I'm being completely honest,
That's fine.
is my birthday.
Okay.
And I'm on vacation.
Okay,
And I would need to be with my colleagues when they come.
that's fine.
So I think we would need to look at
25th, I'm sorry.
September.
September, that's fine. That's perfect. I am also hosting the health fair August 1st.
Mhm.
I think having like the help sheet or cheat sheet or whatever sheet that you guys may create,
Yeah.
just to have somebody table from your organization, I think that would be helpful, because
Yes.
we are gonna have Medicaid navigators, representatives, and things of that nature, and we wanna be able to best support the community about this situation
Okay.
in preparation for September.
And Gina, can you
So,
connect
Chair-
Margaret to.
Commissioner, yeah, I was gonna reiterate, she did, we followed up with Margaret.
Oh,
She said that she's on it, we're on it, this is that part. So we have the, we were on it, so we filled the form and we likely will wait to hear back for clarification, for confirmation from that
Okay.
division,
Beautiful,
participating in the health fair table.
Okay,
Beautiful,
and we'll make
alright.
sure that she has a one-pager with her.
thank you.
No problem.
That is all. We don't have any more questions, and we do appreciate your time and your support, and just what we're entering in this space is not the best, and we do appreciate, so I need, someone to help adjourn.
Okay, go ahead, Jen, I'll second.
I, Jacqueline, adjourn the meeting for today.
Hi, Argelia, second it.
Any discussions, okay, this meeting is adjourned. Thank you, guys.
Thank you.
Thank you
so
Thanks for
much.
having us.
Yeah, that was.
Great information.
Yeah, it was.
Very,
Um,
very good.
Yeah.